this topic, we're going to look at vaginal tears. I get it, it's not the most nicest of topics to talk about, but actually, instead of burying your head in the sand about it, if you learn about tears, then you realise that there's actually things that you can do to reduce your chances of getting them. This is what I want to talk to you about now. So things that you can do to reduce your chances of having a tear. The first one is having a warm compress. So when you're pushing baby and baby's head is being born, one thing that the midwife can do is get a warm compress and put the warm compress on the perineum. This is something that has been shown to reduce your chances of having a tear. The second one is communication. So again, with the midwife, when the baby's head is coming out, listen to your midwife, because she will tell you this is the bit where instead of pushing, you need to let your uterus do what it needs to do. And at this point you will blow. So your midwife will say to you, blow. And remember that from that other session, you go and allow your uterus to do all the work so that you don't have to do anything. The third one is slowly. So one thing that does contribute to the bigger tears is how quickly baby is born at that moment. So again, just listen to your midwife. Remember slowly in your head, and even if you feel a little bit nervous at that point, just think slow, 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 and then do your blowing breaths as well. The fourth one is position. So research shows that pushing on your left side and pushing on all fours reduces your chances of tearing. Squatting does increase your chances of tearing, but that's probably because it's a good way of getting baby out quickly. So you've got to weigh up which one you would prefer, a quicker birth or one where you may be more likely to get a tear. That's up to you. The fifth one is a hands-on approach. So remember how I was saying about the warm compress? If you've got the warm compress, the midwife has got her hands on your perineum again. So this is the midwife supporting your perineum, which has been shown to reduce the chances of getting tears. And then the last one is something that you can do from 34 weeks, and it's called perineal massage. So you can use any oil. You can do it yourself, or you can ask your partner to do it, but it's just using your two thumbs, and then you're going inside the vagina by about a thumb's width, and then you're pushing down on your perineum. This has been shown to reduce tears in first-time mums. In second-time mums, it's shown to not make a difference at all. So perineal massage, you can do it from 34 weeks, and that you can do it a couple of times a week, and that will help reduce your chances of tearing. So if we're looking at tears, we've got to look at recovery as well. So ways to help recovery of your tears. There's a couple of things that you can do here as well that's going to make that recovery a bit nicer for you. The first one is to take pain relief. So there's no harm in taking paracetamol, taking ibuprofen if you feel like you need it. It will make it a lot more comfortable for you. Second one is arnica tablets. So arnica has been shown to reduce bruising. You can buy arnica tablets from any health store. Even if you don't have a tear, it's still a really good thing to do to reduce bruising, and it can also work within a cesarean birth as well. The third one is having a couple of drops of tea tree in your bath. So remember that when you are using essential oils in the bath, put about 3 drops in about 10 mils of milk and mix that within your bath water. Tea tree is an essential oil that does aid healing. The fourth one is stay hydrated. So what stings, stitches, or grazes, if you haven't got stitches but you've got a graze, what stings it is concentrated urine. So if you aren't drinking enough water, your urine is going to be extra stingy basically. So the more water you drink, the less stingy it's going to be. And on that same concept, you can wee in the bath. And you can also get a jug of water next to the toilet so that when you do go for a wee, you can pour the water on you as well, which will just, it's an extra thing that will help dilute that urine. Fibre is number 5. Fibre, so remember how we said about dates? So dates is something that you can use that will help in you avoid an induction. Another thing that dates can be used is to help with that postnatal poo. It's more important if you've got stitches, or at least if you're very sore down there. So anything with high fibre in is going to really benefit you post-birth. So think of things like bran, green vegetables, again, plenty of fluids. These are all things that are going to help you go to the toilet after giving birth. So just to summarise then, get your head out of the sand for this one. Do what you can to reduce your chances of getting tears. If you do get a tear, there are lots of things that you can do to help you feel more comfortable.